Draping is performed immediately after the skin prep. The purpose of draping is to provide a wide sterile area around the surgical site. Drapes act as a barrier surface between non-sterile objects and the sterile field. They allow the sterile team to work in relative freedom without risk of contaminating the wound. Once the patient is draped, the center of the sterile field is defined. Draped tables and equipment are moved into position close to the patient, and scrub team members work within the sterile area. Drapes are large sheets of impervious material or bonded fabric designed to fit the contours of the body. They provide a large sterile surface on which to work, as well as a barrier against the non-surgical areas of the patient's body underneath. Sterile drapes also produce a moisture barrier between the patient and the sterile field. The draping routine for a surgical procedure is a construction process. Layers of drapes are positioned over and around the surgical site in a particular order and orientation. The procedure for draping the abdomen is one of the most common draping techniques and may be used to drape for many surgical procedures regarding the abdominal cavity. Surgical towels made of heavy absorbent cloth are used to make a frame around the incision site. Towels are folded along one edge before positioning them on the patient. Framing the incision means providing an opening in the drapes for the incision. The open area inside the frame is called the fenestration. The fenestration can be square, oblong, or oval if a disposable fenestrated drape is used. The plastic incise drape is commonly placed over the entire surgical site on top of the towels and any bottom sheets and towels which form the fenestration or opening for the incision. The sterile incise drape is coated with adhesive on one side and may be impregnated with antiseptic. The drape is packaged with a paper backing on the adhesive side. The whole drape, including paper backing, is then folded lengthwise and contained in a plastic sleeve wrapping. During draping, the paper backing is peeled away while the drape is applied. This is done in a way that prevents the drape from tangling and sticking to itself. The surgical technologist and surgeon usually apply the drape together. The last drape to be applied is the top drape, also called a procedure drape or specialty drape. The specialty drapes are fan-folded and compact. The folded drape must be positioned over the surgical site correctly before it is unfolded. It cannot be shifted once it is positioned, so it must be correct the first time. The fenestration is centered over the incision site and the drape unfolded over the patient's body. After draping is completed, if any areas of the patient are exposed, the areas will be covered with a plain sheet, which may also be called a half sheet or cover sheet. The rules of asepsis are followed throughout all draping procedures. When draping, visualize the drape as having two surfaces or sides. One side is in direct contact with the patient and other non-sterile surfaces. The other side can only contact other sterile surfaces, such as the gloved hand or sterile instruments. This principle follows the rules of asepsis. The following guidelines support the principles of asepsis and safety during draping. Handle drapes with as little movement as possible. This reduces the risk of contamination and prevents release of airborne particles that can become vehicles for bacteria. When placing a drape, do not touch the patient's body or any other non-sterile surface. Remain a safe distance from the patient to avoid contamination of your gown. After a drape has been placed, do not shift or move the drape. To protect the gloved hand during draping with flat sheets, grasp the edge of the sterile sheet and roll your hand inward. This forms a cuff. Position the drape and release the edge of the cuff. keeping your hands on the sterile side of the drape or towel. Use only non-penetrating towel clamps for securing drapes. A hole in a drape allows a passageway for bacteria to contaminate the sterile field. When drapes are stapled to the patient's skin, the stapled area should be covered by an impervious plastic drape. After a drape has been placed, any portion that falls below the edge of the operating table is considered contaminated. If an area of the drape is suspected of being contaminated, the area may be covered with another impervious drape. After a drape has been placed, the edges are considered non-sterile. Do not reach over the prepped surgical site to place a towel or drape. Instead, move around the table to position yourself. Strike-through contamination occurs when a drape becomes soaked during surgery and solution penetrates to a non-sterile surface. Whenever possible, use only impervious drapes. Drapes fitted with a pocket reservoir and drainage system are used for cases in which extensive fluids or bleeding may cause strike-through. Plan ahead for draping. Verify the surgeon's procedure at the start of the case and stack drapes on the back table in reverse order of application. Have extra sterile towels and sheets available. Once the patient is draped, the bovie and suction ends are passed off the field so the circulator can connect them for use.
I might want a Megadyne tip also. Get that for me.
The sterile light handles are given to the surgeon, who attaches them to the operating room lights. Some other areas of the body that are commonly draped for surgery include the leg, arm, and hand. With the limb suspended, a sterile impervious sheet is placed directly underneath the limb.
Let's go to office.
You drape number one?
Yep, go ahead.
A split drape is secured around the proximal, upper part of the limb.
Drape number two?
Up top. Thank you.
When draping the leg, the foot is excluded from the surgical site by wrapping it with a tube drape or tube stockinette. The limb must be held up and away from the operating table while the stockinette is applied. Rolled stockinette is placed over the foot or hand and unrolled to cover the limb. A fenestrated drape is used to complete the surgical field.
All right.
At the close of the procedure, all countable items used in the sterile field, including instruments, sharps, needles, bovie tips, and sponges, must be recounted to be sure that all items are accounted for prior to drape removal. This ensures that nothing has been left in the patient.
Would you like to do a count?
Lab sponges. 1, 2, 3,
4, 5.
Raytech.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Needles.
1, 2, 3, 4, 5.
And blades.
1, 2, 3, 4. Your count is correct.
Thank you. Once the procedure is complete, All instruments and equipment are removed from the top drape, including the sterile portions of cords, tubing, air hoses, and other devices that can become tangled in the drapes. One member of the sterile team holds any dressings in place while the drapes are slowly removed. When removing the drapes, pull them away from the patient, starting at the patient's head. Begin rolling them and proceed downward toward the feet. Be careful not to dislodge any wound drains. Drapes should be contained with as little movement as possible, with the ends wrapped toward the inside to confine blood and body fluids to the inner surface. The drapes must be placed in a designated biohazard bag.